So something pretty interesting has been happening, and that is Dave Chappelle, the legendary comedian, stand-up comedian, has endorsed Andrew Yang, and he hasn't just lightly endorsed him. He's a very enthusiastic supporter. In fact, I just saw a video in which he's phone banking for Andrew Yang. So he's like a really enthusiastic Andrew Yang supporter, okay? So here he is making a pretty interesting comment. Let's hear it out.
The story of what's happening in Dayton, Ohio. Dayton, Ohio has like a third of the people there living below the poverty line. You would take a poll in Dayton and say, what would you rather have, $12,000 a year or health insurance? Everyone's taking the money. Like health insurance is great, but groceries are necessary too. And people in Dayton are having a hard time getting the things they need. I started imagining what a universal basic income would do for my community, and it would save it almost instantly. We recently suffered, mass shootings and all kinds of, everything that happens in the news happens in our backyard in Dayton, the opioid epidemic, all of these things. And I like the idea of giving people choices, putting the money in their hands and giving them the choices. They would consider things that aren't even an option to consider now. And they can do things that aren't an option to do. And that part of his platform I found incredibly exciting. More importantly, you'll hear people say stuff like make America great again. Well, how about make America feel better again? And I think his platform handles a lot of the emotional content of what being an American is like. Being a homemaker, not being under-recognized, or a worker and being under-recognized. The fear of not being able to pay your bills. This would alleviate a lot of the bad feelings in the country almost immediately. And it's something that I think anyone can get behind. It's an important idea, and for some reason I feel like it didn't get the appropriate media coverage. There's a lot of controversies going around this particular election cycle, and I also like Andrew's pragmatism. I don't look at Trump supporters as my enemy at all. I understand why people vote for Trump. I understand people are desperate, and I think that Andrew's right. You run against the reasons that Trump got elected. I got friends on both sides of the political aisle. I got fans on both sides of the political aisle. A lot of people say professionally it's not wise to support any candidate, but this idea is so good that I think it should exist. And I think the fountainhead of many of the good ideas on the table this year are coming from a single source, Andrew Yang. And for some reason, no one's paying attention to this guy's the origin of a platform that really does address where I think the country needs to go. It's a good plan.
So that is Dave Chappelle's take, and I guess it seems to be like, the answer that he gives essentially seems like he's answering a question about an Andrew Yang versus Bernie Sanders. Otherwise, I don't know why he would be saying health insurance in there. But it's a pretty interesting take, I would have to say, because health insurance can definitely exceed $12,000. That's how insane health insurance is now, but if you don't have health insurance, it's actually even worse. $12,000 a year. If you don't have health insurance, will definitely not cover anything even like minorly significant. There are people who go in for just little, things, and boom, it's way over $12K. So that's not really true. And then he also brings up the opioid epidemic, which it's like, I'm not particularly sure whether or not giving, people just $1,000 a month is really going to fix the opioid epidemic. In fact, I think it might make it worse. Now, obviously, poverty is probably a big reason for the opioid epidemic, but I don't think the solution to that is by prioritizing that. But the biggest thing I have to say here is, I don't know why he's presenting it as a one or the other type of situation, because that's kind of what he's doing here. Unless Andrew Yang is not somebody who's for real healthcare reform, which Andrew Yang is not in favor of Medicare for all. It's not even clear what he really supports because he refuses to tell us. When you read his plan, there's nothing specific in there. There's a lot of sort of blank lines. There's a lot of missing pieces. There just isn't much there. There isn't much real information about what it is specifically that he supports. Does he support a public option? Does he support, giving everyone Medicare? It literally says none of that. He doesn't say any of it. I did a video breaking down his entire plan. You can go check it out. I read through the whole thing. And he doesn't actually give any conclusive remark about what he supports. So you don't even have to, why are we doing one or the other type of thing? So obviously under the Bernie Sanders administration, we need to employ people, get them jobs. We need to expand Social Security so that covers old folks, disability for disabled folks, increase social programs to help people who need groceries, of course. And I'm not opposed to a universal basic income. That's just not my priority right now, and I don't think it's the best thing. So I think that we need to go after multiple things before we get to a UBI. And I think a UBI is more crucial when it is in which automation really starts to take over. So I think that's like a solution for like 10, 20, 30 years from now type of thing, which I'd be down to implement now. But I think that health insurance is more important than a UBI right now. I think that making college education free, because these are all like systemic things that alleviate a lot of the issues that would require a UBI in the first place. All right. So UBI is going to be required in the first place due to things like lack of social safety net. Okay. Not having free college education. Not having health insurance. A lot of these problems that we have, we need to get to the bottom of those, and then we can add a UBI. I'm definitely down for a UBI for sure. But my priorities right now are getting rid of we need to fix those programs that we have. A UBI is not going to fix health insurance. It's not going to. The prices for health care are so insane that it's not going to solve the issue of health care. All right, it's just not. So we have to get to that. We need to make college education free, which Andrew Yang is not in favor of. So federal jobs guarantee is another thing, which just expands infrastructure, giving good paying jobs to people, employing people. There's nothing better than employing people in a society, is giving them a stable, steady, good paying job. And think about what the need for UBI is going to be under a system with all of those things. It's going to be barely any. It is, because we're going to expand Social Security. You're going to have a raised minimum wage. You're going to have federal jobs guarantee. You're going to have disability, etc., etc., all that stuff, right? Health insurance free. So at that point, you don't even really need a UBI, and then we can add a UBI for maybe some of the little, people who still skating by, need help, okay. Then yeah, maybe need a UBI. But by then, honestly, dude, there won't be all that much of a need for it. And I don't think that $12K a year really solves the issue. I really don't think it does. I genuinely don't. Because it's not going to make it so that you're able to pay for college education. It's not going to make it so that you're able to pay for health insurance, etc., etc. Because all that money is going to be already going to living costs. So I don't think that's a good argument, really. I definitely don't think $12K a year to addicts is going to solve the opioid epidemic. I think it's just going to make them buy more opioids. I think that health insurance, health care is the way to solve that. So getting them help is going to do that through Medicare, obviously. So that's what we need to do. All right, that is what we need to do. So don't agree with Dave Chappelle here.